So today we're talking about core strengthening after you've had a decompression or laminectomy. You've had that surgery due to most likely to some nerve pressure, and you want to get back to some core strengthening, but it's important to know what you're doing is safe and effective. And I've rehabbed many people after this surgery, so today I'm going to show you some of my favorite exercises that I like to use to help get people over the hump and get them feeling better and a little bit more functional and just doing the things that they want to do. In the realm of spine surgery, a laminectomy or decompression is typically a little bit more, a little bit safer. It's considered non-invasive in nature in that there's typically just a really small scar, but they remove some pressure off that nerve, typically the lamina, off the spine, and then now you want to get back to your life, right? Your symptoms should be feeling a little bit better. You're either in PT or just ending PT, and today's program is going to be great for those who are about 4 to 6 weeks out and beyond. It's going to go over some of my favorite core strengthening exercises, but today I want to focus on giving you the confidence and the know-how, knowing that what you're doing isn't going to hurt you and what you should be experiencing during it. And so what I am going to ask is that we're going to start on the floor or on your bed. I like to use my mat or my table just because it's comfortable, but you are going to be on your hands and knees. You're going to be on your back a little bit, and then we're going to do some stuff standing. So just keep that in mind before we get started. During, I will be talking to you about what it should feel like and where you should feel it and the engagement. And then in the description, I'll put the reps and sets and give you some more details as well. But get ready, get prepared. We're going to have some fun. It's going to be safe and effective, but that doesn't mean easy. We need to get you back feeling stronger, giving you some more resiliency. You have some things in your life that you want to get back to doing. We have to earn it. So let's go and let's have some fun. Okay, so I have to give you a couple disclaimers before we start. One is that you're going to have surgeons give you a variety of opinions. When you look at post-operative protocols for decompression or laminectomy, some say you can go gung-ho pretty early, and some say be really conservative and don't do much and really don't start strengthening until 6 to 8 weeks. And where I kind of sit is right in the middle. When I'm treating somebody in front of me, as long as they're not having a lot of leg pain and they're not having a lot of burning and tingling into their foot and their back, the incision looks well healed and they're moving around well, I typically start progressing them to kind of match their body. The laminectomy is non-invasive. It's fairly a clean surgery, and those people tend to respond very well. The quicker you can get them up and quicker you're moving. So that's where I want to sit. But I will tell you to kind of follow your surgeon's guidelines, listen to your body. You want to make sure that you're doing the right thing for you in that moment. When I'm treating somebody in front of me, it's definitely based off of the examination and how sensitive they are, and I look at their movement and we go from there. Another thing you must know is that each person and each body is different, and so you want to listen to your body. Don't push past any barriers, but you need to have that encouragement into the uncomfortableness so you can grow, you can build that strength. And during this video today, we're not focusing on mobility or range of motion quite as much. We're working strictly on core strengthening. This is just one caveat of the rehab. When I'm treating that person in front of me, this is one thing, one just aspect of their care is just restoring strength. We're not focusing on nerve mobility today. We're not focusing on regaining mobility in hips and the lower back. That is separate. It is important, but it is separate from this video. We're working on core strengthening. And so those are some things that you must know. You have to default to your surgeon's recommendations. I don't want you to do anything that you're not supposed to be doing, but there is a lot of variety out there. There's no clear evidence of what we should do first. And so just take that for what it's worth. Now, as we get started here, I'm going to be getting in the position. Just like I told you, we're going to be on the floor. And so I'm going to start here and we're going to work that. We're going to be on our hands and knees. But as I'm going into that position, I want to let you know that what is agreed upon with a lot of the surgeons out there is that you need to start walking quickly. Walking is one of the best exercises for your back. I did a past video about core strengthening and walking, so you could check that out. But walking is probably the most important thing that they have you doing immediately after surgery. As long as your incision looks well and you've got some energy in you, then you need to start walking. So this is excluding walking as well. Walking is probably the most important thing to take away and exercise wise when you first start. So aside from that, we've got the walking established. We know that you need to be listening to your body. We're going to get right into the first exercise, start working on some of that core strength. Let's have some fun. So I'm going to get on my hands and knees here. And so when you get on your hands and knees, you want to make sure that your hands are underneath your shoulders and your knees are underneath your hips. Now, when I'm in this position, it should be fairly comfortable. What I'm shooting for when I tell my patients is that we want to start regaining control of the back. And so what I mean by that is motor control. So what to activate and when. So we learn on obtaining neutral spine, which is that if I tuck as far as I can and I poke out as far as I can, I want to sit right in the middle. So if you were to put like a 2x4 on my back, it would be relatively straight. And then from this position, we're going to start, and our first exercise is just rocking back on our hands and knees and going forward and back. So in this, it just helps me lubricate the hips and back a little bit, just regaining a little bit of that flexion mobility of the spine. When you look at different protocols, they're probably going to tell you to avoid end range flexion and extension, and that's completely fine. I think it just depends person to person, but rocking on your hands and knees is a great first exercise here. So we're going to start with about 10 of these and just rocking back and forth, back and forth. So my intention here, and when I work with my patients, is just establishing intention, is that you're telling your core, your shoulder joints, your hips, your knees that you're about to work. Now, if you have a little bit of stickiness or knee pain, just don't go as far. If your wrists are bothering you, then make a fist. It's completely fine. But I'm feeling pretty good right now, so we're going to start on the hands and knees, just rocking. Got about 2 more here. 1, 2. Okay, now we're going to go right into the pelvic tilts or cat camels. And so we're not going to go to end range, and that I don't want you to go as far as you can, but I just want a nice tuck underneath you and then poke your butt out. So what I'm doing is just contracting my abs to tuck my pelvis underneath me to get a little stretch into my lower back and relax. Now, some of my patients experience a little bit of scar pulling here. They're going to feel some tightness in their lower back. Completely fine. One of the benefits of this exercise, of this tuck underneath you and poke out, is one, you are mobilizing that lower lumbar spine, regaining some mobility that you need for everyday movements, such as sitting in your car, or sitting in a chair, or walking. And so we're regaining some of that range just by tucking and poking our butt out. And then we're also establishing motor control. So motor control is that ability to activate what you want and when. It has been shown that in people who have chronic back pain or back pain for a long time, or after an injury, aka a surgery is a controlled injury, that the activation of your musculature changes. There's a little bit of delay. So we need to be intentional during these first 4 to 6 weeks or so in activating what we want. So it seems a little slow and methodical. It's because it is. It's not necessarily about how much you can strengthen. It is how often can you send that signal. So now we've done this tilt, we've regained some mobility, and we're going from here. Now, I want to remind you that throughout any of this, if you experience any of that familiar leg pain or tingling, you need to hold off from that. Like that's telling us that your body's telling you, okay, we need to hold off right now, the nerve is still healing. And that would be a good time to consult your PT, right? Hopefully you had a great PT as you're going through this. So we've done the pelvic tilts or the modified cat camel, just kind of tucking our butt and poking it out. Now we're going to move into some of the core strengthening here. So you're on your hands and knees, you're going to maintain that neutral spine, which we found earlier. And now you're just going arm up and back down, arm up and back down. So as I lift my right arm, I should feel my left side of my body really contract. And as I move my left arm up, I'm going to feel the right side of my body really contract. I don't care how high you can lift that arm, doesn't bother me, doesn't matter to me. Remember, it's about sending that signal and maintaining that movement, or trying to restrict that movement and that rocking as you lift. So I'm having to really engage my obliques here, and really kind of as I'm lifting my left arm, I'm pushing through my right arm into the table, and I'm repeating that process so I can get a good engagement of my core. Don't forget, your core is much more than the six-pack abs. It is not just about the rectus abdominis and the show muscles. It is about the proximal or the stability of your body to give you the mobility with your life. So I'm lifting it up and going back down. Lifting it up and going back down. I typically prescribe about 2 sets of 20 here, and then with about a 30-second rest in between, and we want to push up and go back down. I think I've got like 1 more on each side here. So pause this video if you need to, and just go up and down, okay? Now, my arms are starting to work a little bit, so I'm gonna rock back and just relieve some pressure off my arms. So that's called a quadruped with an arm extension. So we've moved our back a little bit, and now we're moving into the strengthening. So you wanna make sure that you're kind of drawing in your belly button. And if you've done any type of rehab for this, they probably talked about your transverse abdominis and your deep lumbar musculature. And we are hitting those things when we're doing these. And so I'm not ignoring those. I just don't like to do exercises that only hit one muscle at a time. That's just not me. I like to be efficient and effective. Okay, so now you're gonna do it with the legs. You're gonna kick out a leg and come back, kick out a leg and come back. Now, in my folks who've had surgery, where they go wrong with this exercise is that they try to lift that leg too high. Some people just lift it off 1 inch. That's totally fine. Extend out, just like when you lift the arms, we're gonna keep moving that leg in and out, is that you wanna draw in that belly button to prevent that rotation side to side. So I'm not doing this type of thing. You wanna get that neutral spine, engage and extend. Engage and extend. So we're gonna shoot for 20 reps here. I think I've done about 8, 10, 11, 12. So see how high I'm lifting? Even myself, I've had some back pain in the past, but I haven't had surgery. But to feel this really working in my core, I only have to lift my leg just slightly. That's what's great about this stuff, right? It's not really what you do, it's how you do it. So let's be intentional here and work on strengthening that core and get you back to doing the things that you love. So maintaining that neutral spine. If I need any pointers on my form, feel free to let me know. Okay, good. One more here. Good. So we've done the hand, we've done lifting the arms, we've done extending the legs, and now we're going to finish off with a capstone bird dog exercise here. So I'm sure you've done this before, but we're going to draw in that belly button, get that neutral spine, right arm, left leg, hold. Back down. Left arm, right leg, hold. So that little bit of hold there allows me to really enjoy that engagement and come back. Up and hold. Up and hold. I'm always checking in with my patients here to make sure they're not having any nerve pain. Now they may be sweating. They may be experiencing a little bit of achiness, a little bit of uncomfortableness. They may only be able to lift up a little bit. They may only be able to lift and hold for 1 to 2 seconds. Just recognize where you're at. The only person you're competing against is yourself. Up and hold. Up and hold. Up and hold. All right, we'll do one more on each side here. Right arm, left leg. Back down, left arm, right leg. Good. So when I'm working with somebody and I'm rehabbing them and we're going through those exercises, I typically do two sets of each with a good 30-second to 45-second rest. We may be doing some mobility exercises in between, but when we're really just tackling the core, we're hitting those exercises, and now we're going to stand. So move whatever you need to move. You can have something next to you for balance, but we're gonna go over some great standing exercises to finish off the core strengthening after you've had a decompression. So our last 2 exercises here are gonna be standing. You're not gonna see me shy away from standing exercises when I'm rehabbing someone after back surgery. It's functional, it gets you the most bang for your buck, and that activates a lot of musculature. We want to work on our ability to stand up tall and get that nice tall posture and give you some of that lower back and hip strength. And remember, our core is much more than our abs, so we're gonna hit our glutes here and our lower back with just doing a regular squat. So feel free to do this from a chair, but you're gonna see me go all the way up and down as far as I feel comfortable. So sometimes my patients will experience a little bit of back stuff as they get all the way down. It's completely normal. As long as you're not having any leg symptoms, just work with me here. So we're gonna do a set of 15, slow and controlled. You could do it from a chair. Now, since it is working a lot of muscles, you are going to get more short of breath with this exercise. So we're going to get that squat. You're going to enjoy that range of motion. Feel that function coming back. Your squat activates a ton of exercises that allow you to do awesome things. So we need to get back to this. Now, a mini squat is just a smaller version of that regular squat. Totally fine. Keep the weight of your body towards your heels. Go up and down, up and down. If you need to go up and down from a chair, that's completely fine. Got 2 more here. But guys, this is earned. If you want that strength, you're gonna have to earn it. Good. So we've hit the squats. We've done some stuff on our hands and knees. Now our last exercise here is called monster walks. Now you could do this with an elastic band around your knees. I'm not gonna demonstrate that. But if you did that, you'll just get more out of it. Now remember, your core, we're gonna hit that lower back here, right? Your lower back is part of your core. So you're gonna get in like an athletic posture. You're gonna do 3 steps forward, 1, 2, 3. 3 steps to the side, 1, 2, 3. 3 steps back, 1, 2, 3. You don't want anything. 1, 2, 3. Staying in that athletic posture the whole time, moving back and forth, back and forth, and to the side. You're gonna kind of make a little square, right? So forward, side, back, back. So you're gonna make this square. So you can use a small space and stay down in that athletic posture the whole time. My feet are not coming together, they're staying apart the whole time. Monster walk, forward and back. and side to side. Okay, now what I'm noticing is a good quad burn, and it's supposed to be there. So you've hit your back, your core, your quads, your glutes, you've hit all of it, and that's what core strengthening is about after you've had a decompression or a laminectomy. Yes, it does take some work. It's not necessarily the easiest thing in the world, but this routine is effective and safe, and so it's not gonna challenge any structures in your back that should be compromised. It just may expose some of your weaknesses, and that's okay. But just keep after it. Remember, in the description, I'm gonna give you more reps and sets and some more details regarding it. But after a decompression or laminectomy, I've done this many times with clients. They don't necessarily enjoy it in the moment, but they enjoy the results. So if you have anything to add, please put that in the comments and I'll get back to it. But as always, guys, stay healthy, keep moving, and take care of yourself.